Asthma is a chronic lung disease that affects millions of people around the world. It's a condition that's characterized by wheezing, shortness of breath, inflammation, and chest tightness. It causes the airways to become narrow, which results in difficulty breathing. There are several variables that influence the prevalence of asthma within the population, including both genetic and environmental factors. With that said, one factor that people often forget about is their diet and the foods they put into their bodies. Unfortunately, there are several foods that can actually make asthma symptoms worse. However, there are also foods that can reduce air inflammation to make it easier to breathe. And that's the topic of this video. Keep watching until the end, because there's one that I think will surprise you. So if you're ready, let's get into it. Now you may be wondering, what is the best diet for someone with asthma? In general, scientists believe that there are actually two diets that may benefit those who suffer from asthma symptoms: the Mediterranean diet and a plant-based diet. First, let's talk about the Mediterranean diet. Studies began to focus on the benefits of the so-called Mediterranean diet more than 50 years ago. In places such as Greece and Italy, the combination of fruits, vegetables, omega-3 fatty acids from fish, and whole grains was found to contribute to the region's lower rate of coronary heart disease. That's because the Mediterranean diet focuses on foods such as fruits, nuts, legumes, vegetables, and olive oil. This is vastly different than the typical American diet, which consists of high-fat fast food dishes that are frequently made from heavily processed food items and preservatives. The foods of the Mediterranean diet are often locally harvested, seasonally fresh, and undergo minimal processing. Not to mention, these diets also include fewer dairy products and red meat. Instead, olive oil serves as the primary source of supplemental fat for most Mediterranean dishes. Olive oil contains a long list of antioxidants, such as vitamin E and phenolic acid, which helps to lower inflammation, making it easier to breathe. Furthermore, the Mediterranean diet has lower levels of trans fats and omega-6 fatty acids, which tend to increase or exacerbate the frequency of asthma episodes. But aside from the Mediterranean diet, scientists found that a plant-based diet may also be beneficial for those with asthma. Plant-based diets low in saturated fat focus on fruits, vegetables, and legumes, which can also provide anti-inflammatory effects. This diet is typically high in fiber, which is thought to improve lung function and the gut microbiome, reducing the potential for aggravated airway diseases. Even those who suffered from asthma in the past have experienced less frequent and less severe asthma symptoms by embracing a plant-based diet. However, I realize that it's not for everyone. Therefore, if you're not willing to go fully plant-based just yet, at least try to avoid processed meat and red meats that are high in fat and cholesterol. So now that you're familiar with the two general diets that may benefit those with asthma, let's take a closer look at some of the individual foods that you can consider adding to your diet. As previously mentioned, there are several foods with anti-inflammatory properties that may help reduce the effects of asthma. This includes fruits and vegetables, apples, citrus fruits, leafy greens, tomatoes, beans, legumes, turmeric, ginger, salmon, and flax seeds. There are several reasons why these foods can help asthma symptoms, but it's generally thanks to the vitamins, minerals, antioxidants, and anti-inflammatory properties they contain. For example, ginger and turmeric are flavorful spices rich in bioactive compounds and properties that can reduce oxidative damage and provide many positive health benefits for the human body. This includes improving the body's antibody response or reducing inflammation in the airways of the lungs. Not to mention, foods like tomatoes are loaded with lycopene, which is a carotenoid antioxidant that has been associated with improved respiratory health. This may be especially beneficial in those with asthma and COPD. Again, it's no coincidence that the foods on this list are precisely what make up the diets recommended by scientists, which we already discussed. So if you have asthma and are looking to optimize your food choices, you can consider including more of these foods in your diet. While there are many healthy foods that may help to prevent or alleviate asthma symptoms, there are also foods that can make symptoms worse. Unfortunately, many of these foods are very common in the average diet. Again, residents of the United States and many developed nations tend to eat fewer vegetables, fruits, legumes, and whole grains than they did in earlier generations. Instead, they tend to eat more saturated fat and processed foods, which explains why the prevalence of asthma tends to increase in cultures that embrace the Western diet. Some of the types of foods that people with asthma should avoid include fast food, trans fats, omega-6 fatty acids, foods high in sulfites, dried fruits and vegetables, pickled fruits and vegetables, shellfish, alcoholic beverages, processed meats, and dairy products. These often have higher levels of sugar, sodium, omega-6 fats, and saturated fat. They also contain lower levels of antioxidants, micronutrients, phytochemicals, flavonoids, fiber, and omega-3 fatty acids. This combination of low fiber intake and higher amounts of bad fats tends to increase airway inflammation, negatively impact lung function, and increase the potential for frequent asthma episodes. Again, it all boils down to inflammation. Asthma is a chronic, obstructive respiratory condition that causes inflammation and narrowing of the airway in the lungs. This leads to recurring episodes of wheezing and difficulty breathing. Inflammation is the body's natural response to protect itself from infections, injuries, and irritation. However, if this response persists, it becomes chronic inflammation, which can damage healthy tissue and lead to various health problems, including respiratory infections, difficulty breathing, and bronchoconstriction. As previously mentioned, the causes of asthma involve a combination of genetic and environmental factors. Some examples of the most common asthma triggers include pollen, dust, grass, animal fur, cold air, exercise, stress, cigarette smoke, and respiratory infections. Each patient is different. Therefore, each patient may experience an asthma episode due to different triggers. But the long-term management of asthma symptoms is important in order to prevent acute exacerbations and improve your quality of life. This involves eliminating or minimizing the triggers that can cause an asthma attack. And the management of asthma often requires the use of controller medications, such as beta agonists and inhaled corticosteroids. However, as previously mentioned, research has shown that your diet and the foods that enter your body can also play a major role. So do your lungs and entire respiratory system a favor by eliminating unhealthy food choices while including more of the anti-inflammatory foods mentioned earlier in this video. If you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you'll enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching, have a blessed day, and as always, breathe easy, my friend.